Hi, I'm Dr. Tom Denisowitz with the Airrosti Rehab Centers, and today we're going to talk about low back pain. All the information that we're about to talk about is a sample from our live free webinar series, and if you'd like more information about that, there's a link in the description below. But without further ado, let's get started. Let's discuss some interesting facts about low back pain that you may or may not know. Now, this comes from recent literature. Low back pain is the #1 leading cause of disability in the entire world. And those who suffer from low back pain are 3 times more likely to miss recreational, social, or family events. So it's not surprising that those who suffer from chronic low back pain also have a high correlation with mental health disorders. Now, what we do see is less than 5% of patients who suffer from low back pain are good candidates for surgery. So not a high population are actually good candidates to have surgery for their low back pain. And although this is true, we see that low back surgeries are the 3rd leading cause for surgery in the US. So it's possible we might be jumping to low back surgeries a little too early. Here are some misconceptions about low back pain that we hear patients say every day in our office. And the first is we like to blame our parents. My dad's got a bad low back, my grandma's got a bad low back, and I'm here to tell you, unless you have a genetic condition, which most of us don't, your low back pain is your low back pain. Next, discs do not slip. There's no invisible banana peels for them to step on and slide across the room. Instead, discs have bulges or herniations, which generally happen gradually over time due to stress and strain. We also hear patients who have failed with traditional PT or chiropractic and think their next option is automatically surgery. But a lot of times it's more appropriately figuring out what is the cause of that low back pain or the underlying root cause. And lastly, a lot of people think their low back pain is just because of their low back. But often, the mechanical problem can be just above or just below the low back that's leading to the issue. So let's go into the big picture of why most of us develop low back pain. And the reason is because of the way that we compensate and move throughout the world. Now, often, this is going to be really starting at the pelvis and the hips. So a rotation at the pelvis or a tightness and limitation at the hips is going to force more rotation and stress into the structures of your low back. So you're going to get more jamming on a joint or more pulling into a ligament, generally more wear and tear than that area wants to have. And when you have that, you cannot just treat your low back, you have to treat that underlying root cause to relieve and help that low back symptom. Now, if that's true, why don't we all have the same low back pain? Well, that's because here you are an individual. One person may sit all day for work while another person lifts heavy objects, and this person may have to get down on the ground with their kids all day. So your individual stress and strain leads to your specific pain. But most of us do have an underlying root cause that is above or slightly below the low back, leading to that increase in stress and strain. This has been a brief overview from our monthly webinar series, where we go over specific injuries, offer you some simple exercises to try at home, and end with a live question and answer feature where you can ask your questions to one of our providers. For more information on this free live webinar series, there's a link in the description below. Or if you'd like to speak directly with one of our providers, you can sign up for a VIP chat, where you'll have a live one-on-one video teleconference with one of our providers where they can answer your questions at no cost to you. Thanks for joining us today. I'll see you next time.